Let me just say thanks to everyone for your time and attendance this morning. Virtual summits are a little bit tricky, and all of us have probably had more our fill of these things than we ever thought we would have. But thank you so much for joining us. Looking to better define this epidemic within a pandemic at the moment where we are, which is a really unique moment. The summary of what we know about the impact of the pandemic on this, the use of opioids and the incidence and treatment of substance use disorder really is concerning. The Department of Health put out really their best CSMD report ever recently. Congratulations to Dr. Piercy and her colleagues, showing that it really has had an impact in the state of Tennessee, and a bump in emergency department visits, but also, heading for 2020 being the highest overdose deaths per year that we've experienced in the state. So very sobering. On the other hand, there are good news with continuing slow decreases in prescription overdoses, prescription opioids. And so some good things, but also a lot of worrisome things, trends in the wrong direction, probably as a result partly of the pandemic. Also for MOUD and treatment of substance use disorders, it's made a lot of challenges in the past year for connecting people to care and for maintaining people in care. So we just want to affirm that the problems associated with problem opioid use and substance use disorder are really difficult and complex. And as we emerge slowly from the COVID-19 pandemic, we have a really complex situation with no single group or entity with all the resources and opportunities to be able to respond. We know that effective responses take collaboration and a strong team working together with patients across the usual divisions of medical care, inpatient and outpatient as well. So just wanted to briefly say what the purpose of the summit is. Today, we wanted to create a space for diverse stakeholders to come together and learn from each other, to share their insights, and to consider together what may be the next steps in this really unique time emerging from a pandemic. We have 74 registrants who represent healthcare delivery systems, community anti-drug coalitions, staff from the Department of Health and the Office of Opioid Response Coordination, regional opioid prevention specialists with Department of Mental Health and Substance Abuse Services, treatment and recovery providers, state professional associations, and a number of One Tennessee board and staff. So thanks to everyone who is able to join us today, and hope that you will be able to do that for the days to come. We ask you to fully engage during this time. It's hard virtually to do that, but emphasizing the need to learn, to share, and together to consider in the next 3 days the challenges and opportunities before us at this moment. The goals of the conference are to understand the recent progress trends and gaps in safer treatment of chronic pain and substance use disorder across the state, to share successful approaches, current and planned activities, to provide opportunities for participants to get to know each other better. Again, a little bit of a virtual challenge here, and that participants will have a better understanding of and appreciation for what others are doing and why they're engaged in those activities. This will also help One Tennessee in their strategic planning process, which is underway.